on to this series on understanding and addressing vaccine hesitancy within the Muslim community, and especially from an Islamic perspective. Inshallah, in this episode, we will be looking at vaccination. Why is it important? The challenges and the issues surrounding hesitancy, and how to move forward within the Muslim community on the subject of vaccination and immunization. I'm your host, Muhammad Nuruddin Lemu, and with me to discuss today's topics are two of our distinguished visitors and guests, Brother Ibrahim Bello, who works with the IBB Specialist Hospital and has a master's in biochemistry and comes from a background where I think he's very familiar with the science. We are also joined with Sister Ruqayya Kinta, who also comes from a microbiology background, all science students, and we look forward to your contributions, inshallah, to this discussion.
Thank you.
I'd like to start, and after welcoming both of you, Mala Ibrahim Bello, could you introduce this subject of vaccination? What is it? Why is it important? And we'll get contributions from the two of you.
Bismillah, alhamdulillah, salatu wassalamu ala rasulillah. It is important that we understand vaccination and why it is important as Muslims. Of course, vaccination or immunization basically is the introduction of attenuated or weakened version of the disease-causing organism or its parts into the body over time, so that the body will develop a sort of antibodies against the real disease in the future. Usually, the dosage is given in a way that is not sufficient enough to cause disease. Now, vaccination began in Nigeria as far back as 1956, when smallpox was a problem. Thereafter, a number of other vaccines were developed, particularly in series, which are given from childhood. And alhamdulillah, they have helped save a number of lives. Usually, you have vaccines that developed in those years. Thereafter, a number of them, including those that were targeted against whooping cough, tuberculosis, diphtheria, measles, and a number of what you call child killer diseases in those days. So over time, there has been improvement, and whenever there is a new epidemic or a new threat, governments and the health professionals go back to drawing board and see how to counter it. More recently, the polio vaccine came on board. Usually the polio vaccine is part of those things given to children and their childhood. You have OPV, oral polio vaccine, and IPV, inactivated polio vaccine. But then they came to limelight again because when it became epidemic, particularly in the northern Nigeria. And then more recently, you have the COVID-19 vaccine. And very, very recent, of course, we have this HPV. HPV vaccine, human papilloma virus vaccine, is usually given because the virus is believed to be one of the risk factors or the causative agents of cervical cancer. So vaccines generally don't prevent disease per se, but they prepare the body to fight disease when it comes. Usually what happens is, for a number of people that are vaccinated against the disease, they overcome it. They don't get they don't get to contract the disease. And if they get to contract the disease, the effect is minimal. Again, if a good number of people are vaccinated in a community, it confers a sort of communal immunity, which we call herd immunity. What this does is that it even provides a sort of preventive, a prevention to those few individuals that might remain in that community that are not vaccinated. So it is important for us to know that vaccine is supposed to be taken by everybody, because if one person refuses to take, it could be a threat to others. But of course, over time, there's what you call herd immunity, which is usually a sort of communal immunity that a community develops against a particular disease.
So this herd immunity is when sufficient number of people are vaccinated, that even if somebody has the disease or the virus, it's difficult for them to pass it on to another person because this person is surrounded by a wall of immunized people, and so they find it difficult to pass on. Sister Ruqayya, what would you add to this discussion?
Thank you very much. I think vaccination in general is not just experiment on populations, but these vaccines are actually produced using standard scientific methods which have been validated upon, just like other life-saving drugs we have, medicines we have over the history of medicine. And this, in the production of this vaccine, they have gone through various stages of development, from test on laboratory animals to test on humans, before they have been released for public consumptions. It is important to note that these vaccines have been tested and endorsed by multiple vaccine regulatory bodies around the world. One of them is the World Health Organization, and they have to test it. They have to check whether it is safe for consumption before it is actually taken out for people to use these vaccines. Unfortunately, as important as vaccination is, and also efforts of government and other stakeholders to see that vaccine is made available in most communities, we have a lot of vaccine hesitancy, especially in the northern part of Nigeria. In recent times, we had the COVID-19 vaccine, which was introduced to protect against the coronavirus, the Mpox vaccine to protect against the monkeypox, and also the HPV vaccine to protect against the human papilloma virus. Just as Mala Ibrahim said, this virus causes about 70% of cervical cancer. And this is made available for girls around 9 to 14 years. And we also have the other version, a catch-up vaccination, we call it, for women that are up to 26 years. And resistance to all this vaccination is not really the first instance of vaccine hesitancy in Nigeria, particularly among Muslim communities. Let's take, for example, the polio vaccine. Nigeria was considered polio-free in 25th of August 2020, and this is after about 3 years without any confirmed case of polio. But it was really, really challenging to eradicate polio in this region, that's the northern part of Nigeria. And this is majorly due to concerns, misconceptions, conspiracy theories surrounding polio vaccine. And it is really concerning that as of 2024, polio remains an endemic disease in just 2 countries around the world, and that is Pakistan and Afghanistan. And these are Muslim majority countries. And most of these countries are really having concerns regarding vaccines, especially those coming from the West. So this is really, really concerning.
Definitely. To say of the 195 countries in the world, we are the last in Nigeria. It just tells you how backwards the thinking of the community, and particularly those with vaccine hesitancy. Because whatever it is that we are afraid of, if country number 1 is polio free, country number 2, number 3, number 100, number 120, number 130, Buddhist countries, Hindu countries, Muslim countries, Christian countries, atheist countries, Shinto, all sorts of communities have all graduated and are polio free. The question is, where's this hesitancy coming from? And so, Sister Ruqayya, I would like to ask, what studies can you refer to that have at least helped us understand our own community in Nigeria? We leave Pakistan and Afghanistan for now, but from studies conducted locally within northern Nigeria, what are the results that can help shed light on the vaccine hesitancy? Where is this delay, coming from, and why has it taken so long? Hopefully before long they would come out with a malaria vaccination. But if the reasons for hesitancy still remain, we will still have the same problem.
Exactly.
So what are the causes of this challenge of vaccine hesitancy?
Okay, thank you very much. So actually, to address this issue and to intervene in this issue of vaccine hesitancy, the Dawa Institute Islamic Education Trust conducted a survey, both online and offline, within the period of 3 months. That's in December 2021 to February 2022. And that was an online and offline survey. And we had about 2,713 people who were interviewed offline. We also had the online respondents, who are about 424 people. And this makes a total of around 3,137 people. And special attention was given to the opinions of Islamic scholars, leaders of Islamic organizations, teachers in Islamiyat, students in colleges of health technology. There are many other community members. We had about 30.4% who had not taken the vaccine as at the time of the interview. We had 36.2% that are willing to actually take the vaccine. But we also have 33.3% who are not sure whether they are to take the vaccine or not to take the vaccine. In the offline survey, we had research assistants who conducted interviews with over 1,000 people across over 70 tertiary institutions in Nigeria. And these institutions include Islamiyat, schools, mosques, primary healthcare centers, police stations, radio stations, and other paramilitary services. And our questions were majorly on taking the vaccine, the reason for the hesitancy, and who are the most trusted authorities when it comes to information of COVID and other vaccines. Who should you listen to? Are you just to listen to anybody? Or you should have certain people that when they say this, because they are the most respected people and they are the most knowledgeable when it comes to issue, particularly on vaccine. So we collated all these concerns, and it was grouped into 6 major areas. We have the first one, which is the conspiracy theory.
So these are the major categories of reasons for hesitancy.
Yeah, so we had many reasons, but we categorized them into 6 major ones. So we had the conspiracy theory, we had the ignorance of basic biology. Some don't even know why not. So they just hear this person say, and I'm just picking it up. Concerns about also the effectiveness of the vaccine, trust-related issue. They don't trust who is speaking. Concerns about the side effects of the vaccine and other miscellaneous concerns. Most of these major arguments were found within the 3 major categories, and those were the conspiracy theory, the ignorance of basic biology, and also trust-related issues. So all these arguments were really responded to in a book produced by the Dawah Institute. That's the Islamic Responses to Vaccination, Answering Doubts and Objections to COVID-19 and Other Vaccines. And Alhamdulillah, this is the first of its kind when it comes to survey by an Islamic organization within the Muslim community. And one interesting thing about this survey is it gives special attention to local gatekeepers, our imams, our activists, our preachers. It gives great attention to them, including leaders of Islamic organizations like the Muslim Student Society of Nigeria.
This is very interesting. So what you're saying is, from the surveys, about 30% or 33, basically a third of the population,
I'm not sure,
had not taken vaccinations.
Another
third were hesitant, so therefore they have not yet taken. They're more on the fence. And 1/3 approximately had taken. In other words, with that type of data, it's nearly impossible to get herd immunity. If 2/3 belong to, I have not taken, I'm still deciding, or I will not take the vaccine. So we are dealing with a big issue. Malam Ibrahim, what other lessons from this survey do we get that can help direct us regarding what to do about this problem?
From what she has said, there is a serious concern because vaccines or vaccination is a sort of primary preventive measure against contagious disease. So it's not like one-off thing. As more challenges, more threat of disease come, we expect vaccine. And over time in history, vaccine have not been an issue. What happened somewhere along the way is still a problem. Now, but the thing is, the content of this material, this series, among the surveys done earlier, where we discovered that the most respected voices on these issues of vaccine are actually Muslim health professionals. Because they are Muslims, there is that trust of religion and faith, and because they are respected. So we discovered that these are the people that are most qualified to address issues that are faith-based. More so because most of our people here trust more faith-related issues. Like whatever comes their way as a Muslim, they want to know what is the religious position. So we want to believe that the essence of this series is to empower the Muslim health professionals and the Muslim scholars alike on how to respond to these arguments intellectually and even from the textual point of view, Islamic textual point of view. More so, if scholars and health professionals come together to solve problems, it will help in immunizing the Muslim populace against such prejudice and biased arguments that most of them are just misinformation, and unfiltered arguments. So as Muslims, we need these kind of things because over time we come to discover that the arguments are just similar, they are repeated. They just repackaged and mutated, so to say. Whenever a new vaccine comes, you discover that the same arguments, and allegations of conspiracy theory and all of that were said during the polio vaccine were the same thing that were used to counter the HPV vaccine, were the same arguments that were used to counter COVID vaccine. So if Muslims have good understanding and clear explanation, unbiased of course, they will better be prepared against this kind of arguments as they resurface every now and then. More so, it will help them to be more prepared to accept new vaccines as they come. Because we have more important issues that we are hoping that their vaccines will soon be available, like malaria, for instance, and a number of things. And if we don't get these things addressed earlier on, which are mostly fake news actually, when people don't have filter, when people believe anybody is qualified to say anything on whatever subject comes their way, when people don't know who exactly is the expert, when people don't know what are the bases of assessing arguments, when people don't know who is qualified to say what. So the essence of this kind of series is actually to provide these kind of solutions. The material is made flexible as a resource guide that imams can access it, lecturers, Islamia teachers, and other people can actually access it as a way of getting resource to make clarification to their students. So what was done is a number of arguments that people come up with when it comes to vaccines are taken one after the other and addressed in detail. So that once you have that, any other thing that comes, you already have like a ready-made answer, so to say. So this is the essence of the presentation, and these are the kind of things we hope to see in the next coming series.
This is very interesting that the surveys by the Dawah Institute regarding vaccine hesitancy within the Muslim community brought up Muslim healthcare professionals as actually top on the list when it comes to the most trustworthy voices. The surveys also showed the importance of religious scholars and religious narratives, but also the respect a lot gave for the NCDC, the National Centers for Disease Control, and the World Health Organization. And I guess, medical doctors are not the ones who speak a lot when it comes to public. They are not usually the charismatic, hold a microphone. And I think what this shows is probably healthcare professionals need to do more than just staying in hospitals. Those who want to help communities overcome vaccine hesitancies of various forms should probably also recognize that most people have fallen sick at some time in their past. They have gone to people who are healthcare professionals. They have been helped, or their children have been helped, or somebody in the family has been helped, and the person was cured. In other words, there's an more instinctive understanding that this group of people know what to do about health issues. It's just that when you are now bombarded with social media and things that weren't there before, so I guess we, as a community, we had no problem with supporting what became a final eradication of smallpox because everybody knew who to listen to. Now you've got competing voices coming on social media claiming to be more authoritative and creating confusion in the minds of some. So our hope is that both religious scholars, medical professionals, and those who want more faith-based crafting of the arguments, to get that from the series. What else, Sister Ruqayya, would you add to what Mala Ibrahim said regarding the intention of the series? We're looking at a total, including this one, of 11 episodes, but we are hoping we could break each of the episodes down. But regarding the intent, the objectives, purpose, what would you add?
I think what I will say is that the threat of a serious pandemic like COVID seems to have subsided, but seriously, our immunity as a community to fake news, to confusions, to folly have really been compromised. So now more than ever before, we need to be intellectually vaccinated, which is very important. So we need to be intellectually vaccinated in order to respond to arguments of anti-vaccination before the next vaccine program comes, because that is when our emotions set in and it becloud our judgment and assessment of informations that are coming from our most respected organizations like the epidemiologist of World Health Organization and also the Center for Disease Control. So we need to be very careful. And this program is not just to respond to COVID-19 vaccine, the Mpox vaccine, the HPV vaccine, but address common perennial arguments against vaccination. We hope that this program, inshallah, will help our scholars, our imams to better understand what vaccine is, to better understand the issues of hesitancy and how to approach this argument within their local communities. And this will be the contribution of Dawah Institute to see a healthier and better society. As we remember, the intent of the Sharia is to protect life, and the protection of life is the first and foremost intention of the highest intent, of the Sharia. So I think this is the major thing we actually want to address in this program.
Thank you very much. I like the point you made about how, as a community, our own intellectual immunity seems to have been compromised, that we seem not to know who to go to or who to listen to when the stakes are high. I guess just like in business, it is better to agree how to divide your money when you make profit before the money comes.
Exactly.
When the money comes, then people start emotionally spending and people forget the contributions of the others. And so I think, in line with what you're saying, the need for us to discuss these subject areas as a community when we don't have the tension. There will always be tension. Unfortunately, there's always a new disease that people are discovering a vaccination for. But vaccines seem to be the most promising medical solution for a lot of diseases and illnesses. Sure. And we are hoping that in the next series, we will be able to start going into a more granular, deeper understanding of the specific reasons for hesitancy. I'd like to thank you both for your contributions to this session, Brother Ibrahim, Sister Ruqayya, Jazakumullahu khairan. Until next time, inshallah, Nuruddin Lemu saying Assalamu alaikum wa rahmatullahi ta'ala wa barakatuh.
بسم الله الرحمن الرحيم